Hello, everyone, and welcome. We are so excited you're tuning in today for an important and inspiring conversation about elevating patient-centered care for alopecia areata in patients of color. I'm Dr. Mona Shahriari. I'm an associate clinical professor of dermatology at Yale University, and I am thrilled to be here with my colleague and friend, Dr. Benjamin Ungar. Benji, why don't you just go ahead and introduce yourself?
Good morning, everyone. It's a pleasure to be here. Benjamin Ungar, or Benji. I'm an assistant professor at the Icahn School of Medicine at Mount Sinai in New York City, where I'm also the director of the Alopecia Center of Excellence. Really looking forward to the discussion today.
And we're extra lucky today because we're joined by a very special guest, Camila, who's here to bravely share her journey living with alopecia areata. Camila, thank you so much for being with us. We're honored to have you.
Thank you very much for having me. It's a pleasure being here. Thank you.
All right, guys, before we dive into alopecia areata specifically, let's just take a step back and just talk about hair for a minute. So we'll move on. Perfect. Because here's the thing, for so many of our patients, hair isn't just hair. I can't tell you how many times I've had a patient share a story with me about being told that, oh, it's no big deal, it's just hair. Or having their insurance deny a treatment because alopecia is seen as a cosmetic issue. And honestly, that kind of thinking is really what misses the mark for our patients. For me, at least, I feel like hair is deeply tied to a patient's identity. It's how we express who we are, where we come from, even how we connect with our culture and our community. And it's not just about appearances. It's emotional, it's personal, and it's really powerful. Benji, I'm curious to hear your thoughts because I know you've had similar conversations with your patients.
Yeah, it's one of those things where it's hard to appreciate until you hear from people directly because, those of us who are fortunate not to have alopecia areata don't necessarily have that kind of visceral connection to what it means to lose your hair, lose your eyebrows, and so on. One of the things that has really stuck with me and really struck me is a very common thing that people with alopecia areata say, and I know that we're maybe jumping ahead a little bit, but I think it's really emblematic of what it means to have hair to people, is that if you don't have the hair that you expect, that you're used to, look in the mirror and don't recognize yourself. And that idea of not recognizing yourself because of hair is just such a powerful part of self-identity. So it really, really can't be overstated just how important it is.
I can't agree with you more. And I think we can both agree that when someone loses their hair, especially without knowing if or when it'll come back, it can be truly devastating. So let's talk a little bit about the burden of hair loss in alopecia areata. And we know that hair loss impacts a patient's confidence, self-image, the way they even move through the world. And that's why I always say the psychosocial burden of this condition cannot be overstated. And conversations like this are so important. So in your experience, Benji, how do you think alopecia areata is impacting your patients' lives? And let's go from there.
Yeah, so I think in some respects it may be again counterintuitive to people who don't have experience with this themselves or with friends, family. But in some respects, this has one of the biggest psychosocial impacts of any skin disease that we deal with. Again, there's a sense of identity. There's interactions with the world around them. Even in people who are fortunate to have their hair regrow through treatments, there's this kind of cloud hanging over their heads of, when am I going to lose my hair again? And it really impacts really every aspect about daily life. We know this on an individual basis with patients, sitting in front of us. There are some studies that support that. People with alopecia areata report negative interactions with other people, other healthcare providers. So it really just permeates every aspect of daily life.
Well, and I think the functional aspect of it's important to touch on as well, because like if you don't have eyebrows, that sweat could potentially get into your eyes. If you don't have eyelashes, the dust is going to potentially get into your eyes. And these are little things that I think we take for granted for those of us who don't have alopecia areata. But when we talk to Camila, hopefully she can shed some light on what it means to live with those sorts of issues. Well, I think that's a good segue into us dermatologists. We can talk about the burden of areata till the cows come home, but it's a whole nother level for us to talk to someone who's lived it. So with that, I'm really excited to bring Camila into the conversation. Thank you again for being here and for being willing to share your story with us. So to start, Camila, when did you first notice your hair loss and what was going through your mind?
So I was a little kid. I needed to ask my mother actually because I've lived with this for my whole life. I was 3 years old. She told me it was I was moving to another place, to another school, and then she mentioned that was very hard because I loved my school. And then she saw this little patch, and then she took me to the doctor, and then like they didn't know right away. They tried to take a little sample, thinking it was something else, and that's so I personally don't remember because I was a little kid, but it's been like with me forever.
Yeah, so I want to follow up on that. The original patch that showed up was many years ago at this point, but it's been something that's stuck with you obviously since then. We unfortunately don't have a cure for this condition. It is a chronic one.
Mhm.
What has your journey been like since at least you remember getting a diagnosis, understanding what is going on for you and your scalp and your hair loss?
So, like I said, I asked my mother about it. So I was a little kid. She took me to the doctor. They had topical like medications given to me. It's hard. It's just like what you guys were saying. It's exactly how you could like really express how we feel. It's hard. You don't want to see people. Most likely, you don't want people to see you. You want to hide. You don't want to be part of anything. I was wearing winter hat when it was summer. My husband never saw my patches. Never. I never let him
Wow.
see. So it's hard. It's and I remember what you mentioned that some doctor said, "Oh, it's aesthetic." No, it's not. When you cannot do anything with your life, you're gonna understand that it's not aesthetic. It's a lot more than that. It's a lot.
Well, building on that, how do you think having alopecia areata impacted your personal or even your professional life? Were there any moments that you remember being particularly challenging?
So when I was in school, high school, I remember having patches, but it was never like too much. So I couldn't hide here and there. But it's still, you were like afraid someone is gonna see because unfortunately we need to deal with like people bullying you or something. So when I was a teenager, it was fine. And then it started like being very difficult when I was 22 years old, 2010, and then it was hard, very hard, because I would like get some like makeup to cover here, cover there, and then you cannot move here, there. It's hard. And then I remember quitting school. I didn't want to do anything. It's like I said, you don't want people to see you. You want to hide. It's like
Yeah.
surviving mode. You're not living. You're like surviving.
Hmm.
Yeah, that's so tough. And again, even the words you're using, I think really highlight the depth to which it has an impact, survive, living your
Mhm.
life.
Yeah.
Um, on what is hopefully a more positive note, how has effective treatment kind of transformed your life?
It changed everything. Everything. I went back to school. Now I'm a nurse. I have work tonight. But yeah, I could go back to school, try to live again. Because it changed everything.
When,
Everything.
when they first came to you with some new novel treatments, did you believe this was going to be different than the other treatments you've been given?
To be very honest, I always believed something was going to happen, because it's very hard to just accept. And then I swear to God, I really admire people that like they can like, okay, I have this condition and I'm gonna embrace that. I couldn't, unfortunately. I couldn't. So I never give up on finding something. I found studies, I read about it, I tried everything. And then like that's it. It's just it's hard. I remember once a doctor, like I mentioned, she said it was aesthetic. I said, don't you think it's never going to be approved, any kind of medication? And she said, no. I was
Wow.
But I was still like, no, it's gonna happen because people like you are trying the best to show people that it's possible and then that is important. It's not just aesthetic. It's not.
And did you feel there were some providers, besides that one, of course, that weren't listening to you, and others who really listened to your story and tried to help? Was there that distinction amongst your healthcare team?
To be honest, I don't think she was just disregarding my feelings. I think that she just really thought that it wouldn't be approved because of financial matters. I really think she was not just trying to say, don't worry about it. But no, the doctors that I had, they tried to listen. They understood, thank God. And then you guys are amazing, like talking about it, trying to bring this to people to understand, because like some people, they don't know what it is. Most of the people don't know what it is. Like, actually, when they see, they think it's, like I said, when years ago, thought it was fungus or something. It's something, it burned or whatever, something like that. But it's a lot more than that.
Well, thank you, Camila, for sharing that powerful story. I think a lot of what you touched upon as part of your journey are things that we're going to touch upon in the rest of our conversation here. So let's shift gears and talk about how we as dermatologists can better diagnose and manage alopecia areata so we can optimize the care for patients like Camila. Now, we know that alopecia areata hits our patients with skin of color harder, with higher prevalence, more severe forms like totalis and universalis, especially in Asian American and Black American communities. But despite this, it's often missed or misdiagnosed in these groups. I think, Camila, you touched upon that earlier. So Benji, can you give us some practical tips on how to assess hair loss in patients with skin of color and give us some insights on misdiagnoses that we should be aware of?
Absolutely. So, I think that for many people who treat alopecia areata, there is a relatively common presentation that's very characteristic of alopecia areata. The sort of typical nice round patch of hair loss that is relatively unmistakable, in most cases. But I also think that part of it can really bring a sense of complacency, where you say, okay, I know alopecia areata. If it doesn't look like that, then that's not what it is. But in many cases, there are other conditions of hair loss that need to be considered, and that can, be a little diagnostically challenging. And I think it's always important to take a step back and say, how confident am I in? How confident am I in this? Am I missing something? So many people with skin of color will, and I think Camila even mentioned this, it's fungus. So tinea capitis is often a diagnosis that's given when it should be alopecia areata. Traction alopecia, very, very common. And, I think it's it's actually not uncommon for skin of color patients to come in to see me and almost preempt and say, oh, it's not from tight hairstyles, because they've been to a number of, dermatologists or other providers who kind of dismiss and say, oh, this is traction alopecia. This is because of the tight hairstyles that you've had in the past. And it's dismissive both in terms of the diagnostic accuracy and also in terms of the potential for treatments and, different aspects, almost blaming the patients for the hair loss that's been caused. Additionally, CCCA is another common condition that may be confused, especially if it presents with sort of relatively well-defined patches of hair loss on the vertex scalp. That can be something that's confused as well. And, that is often, again, something that's dismissed as, hey, we can't do anything to treat this. Well, if it's misdiagnosed and it's alopecia areata, there are treatments that can potentially work. So those are certainly a few things that come to mind. Mona, I don't know if you have anything to add in that regard.
Yeah, the only thing I would add, you mentioned the fungus or tinea capitis, and so did Camila. That makes me think of my pediatric patients with alopecia areata, and is how many of them with skin of color come in with that presumed diagnosis. And the misconception, I think, is that areata is rare in children, but I think we're getting better at diagnosing it. And so now we're actually seeing it disproportionately impact children with skin of color because we're just getting better at diagnosing it. So the bottom line is we just got to have that diagnosis in the back of our mind so that we can avoid delays and then allow for these patients to be treated effectively. So now, Benji, everything that you've discussed shows us that diagnosing areata can be challenging, especially in those with skin of color. And sometimes these challenges are going to lead to delays in starting therapy, but early intervention is going to be key to improving outcomes. So now let's go through the therapeutic landscape for alopecia areata and discuss some best practices to ensure our patients are treated effectively. So when it comes to therapy selection, I tend to decide who is a candidate for a localized therapy like a topical or intralesional steroid steroids and who was a candidate for systemic, like a JAK inhibitor. And there's so much that goes on in my mind when I'm deciding which camp to put my patient in. And I personally like the alopecia areata scale, which was developed by a group of experts to help determine disease severity in clinic. And it does have 3 objective categories. A SALT of less than or equal to 20 is mild, 21 to 49 is moderate, and 50 or greater is severe. But keeping that patient experience in mind, this expert group also allowed the severity rating to be increased by 1 level if the patient had a negative impact on psychosocial functioning. We talked about how important this is. Noticeable involvement of eyebrows, eyelashes that can frame the face and even have functional issues for the patient. If the patient had inadequate response to therapy after more than 6 months of treatment, or in those individuals who have diffuse positive hair pull tests consistent with rapidly progressive alopecia areata. This is that person that you know is going to be bald in a matter of weeks, and you want to make sure you intervene quickly. And in my eyes, anyone with moderate to severe disease is going to be a candidate for systemic, regardless of the insurance company saying that it has to be severe, quote unquote. But Benji, can you review how you decide which patients are ready to go on that advanced therapeutic like a JAK, and who's going to do well on topical or intralesionals?
Absolutely. So, the first thing I will say is this is a conversation when we have the patient in front that it takes more than the short amount of time that we're going to be able to allot to it here. But I do think that there are a number of kind of overarching trends that definitely apply to most people and are worth considering. The first being, and I could not agree more with you, the framework that you discussed, alopecia areata scale, in terms of determining who is a severe patient. Is one that I subscribe to as well. Often SALT, or the kind of percent of hair loss that's used by insurance companies in clinical trials, is really missing a lot of what it means for this disease to impact people. And so, eyebrows aren't even part of that score. And you know what? We know that it can have a huge impact. So I do think about it in those terms. And as a general rule, if someone is severe, that probably warrants, in most cases, oral or systemic treatment. Now, one of the things to keep in mind is that this is, we're talking about mild, moderate, severe, putting them into discrete categories, but there's a whole spectrum of how severe this can be and how much involvement there can be. And in many cases, we think about topical treatments. I would say at best they're variably effective. And so often in relatively mild cases, we talk about intralesional injections, and that can be effective in many cases. But now let's start thinking about that more severe end of mild. Let's say, 15, 20% of the scalp is involved. And that's dozens of injections, and it's not going to respond in 1 month. We're talking about monthly or, every few weeks injections where someone's getting 20, 30, 40, 50 injections at a time. And that can be 6+ months of treatment. So there's a big burden of even getting a treatment that might be effective, and it is not always effective. And that's can be really unpleasant for people. And so when we think about the alternatives, we say maybe there's a more effective, sustainable treatment that people can tolerate much better, and hopefully will have a better clinical response. And that brings us to the oral medications. Now, I'll just say briefly, we always have to think about the patient in front of us and the kind of considerations that apply in their lives. So there's rarely a hard and fast rule, but I think in general, that's kind of the framework that I think about and say, hey, you know what, let's talk about some of these treatment options.
Those are fantastic pearls, and I love how we take such a similar approach to shared decision making, because that really does have to be at the heart of any treatment regimen. Now, beyond picking a therapy, that's probably the easy part. How do you set expectations with your patients and make sure they're not calling you in a month and saying, Dr. Ungar, I still don't have any hair?
Yeah, I mean, that is probably one of the most important aspects of just understanding this condition, because it is unfortunately a chronic condition, as we mentioned before. We don't have a cure, and this is something that requires ongoing treatment. And again, I think Camila mentioned this. I know that many of my patients say this. There's this kind of fear of things backsliding and losing hair again, even if there's successful treatment. So we need to not only get the hair back, but keep it. Now, the reality is that unfortunately, hair takes a long time to respond to treatment, and even our most effective fast-acting treatments are going to take several months at minimum. And so that's a conversation that I have from the get-go. No matter the approach that we take, this is going to take time. And I think that is really, really, really important. Maybe it almost seems obvious, but nevertheless, I just want to emphasize that. If someone calls back in a month, hey, it's not growing yet, we kind of expect they may stop treatment. They may not come and follow up because they expected a response and say, hey, this is not working for me. And so kind of understanding when the patient says, let's give this a try, let's proceed down this treatment path, giving it kind of its due and saying, hey, this is going to take some time. There are many patients, who I've had where we have that conversation periodically. And then when they begin responding, it's that much more important because they stuck with it. So that is something that really, and we always emphasize it, even follow up, hey, the hair hasn't grown yet. It's too soon, let's give it some more time.
Yeah, and I think another piece of the puzzle is once they get the hair, how long do I have to be on this medication is the next question. And I kind of tell them, I'm like, if I want to keep my highlights, I see my stylist every 8 weeks. If you want to keep your hair, take your pill every day. And I think that's a good way to normalize it for them because they're not being subjected to this chronic treatment. It's something that they need to be consistent with in the long term to really be able to maintain the growth that they've achieved. Do you have any other approaches to those long-term expectations?
No, I couldn't agree more. I think about this as a journey. It's a marathon, not a sprint. And I think that, for someone with alopecia areata, this is their life. So that big picture view needs to be taken into account. It's not about regrowing the hair alone. It's okay, where do we go from there? And, the current treatments do require ongoing treatments. And in most cases, to maintain that response. And so if someone's going to start on that path and give few months, several months for the hair to regrow, I think it's important and needs to be factored in. Where do we go from there? And so so for the time being, we stick with the treatment. There may be treatments in the future that change that kind of perspective and paradigm, but that's definitely where we are now. And patients really, I think, understand that when they say, okay, let's go ahead with treatment.
Yeah, I think disease modification is the dream. I know we're not there yet. We just started to have FDA-approved options to treat the condition, but it's something to look forward to. And one other approach I take with my patients is I try not to have tunnel vision to just the hair loss in the scalp. I do screen for comorbidities like thyroid disease, atopic dermatitis, asthma, vitiligo, because sometimes knowing the comorbidities can help direct therapy selection as well. Now, to round out our discussion, I'm also going to stress the importance of culturally competent care because I know, Camila, I'm sure that was a component of your journey with alopecia areata. And what I always tell my residents is you can't just walk into a room, tell an African-American patient that the organic oil their mother and grandmother and great-grandmother swore by is terrible. That's going to shatter trust instantly. So we have to remember that when we're treating our alopecia areata patients who have skin of color, that we have to come to every encounter with an open mind, put our biases and check them at the door and really listen, because no matter what we think we know about someone or their background, it might not apply to the person that's sitting in front of us. And I think listening is key to building trust and delivering better care. And like Camila mentioned, listening was a big part. To tell her, for example, the hair loss was just something that was cosmetic, that didn't resonate with her. And that was not what she needed to hear. So we can always do better when it comes to these sorts of things. I put my foot in my mouth so many times. We just got to be aware of it. So this is a nice yeah. So this is a nice segue into addressing disparities in care for patients of color with alopecia areata. And we know our patients encounter unique challenges when it comes to the diagnosis and management of their disease, and whether it's challenges with accessing a dermatologist, representation in clinical trials or advertising campaigns, mistrust in the healthcare system as a whole. But Benji, can you elaborate some of the challenges that your patients face specifically?
Yeah, I absolutely, I just want to kind of, I guess, repeat a couple of things that we discussed that I think are directly relevant to this. The first being, this is an ongoing treatment that requires follow-up and time and trust. These medications are often excellent. No medication comes without risk. And so even the idea of balancing the benefits and the risks need to be done, with the partnership of the patient. If there's no trust, it's going to be an unsuccessful treatment. And, I'm just thinking again of the patient that came in last week, and I began, describing what was going on from my perspective, and she interrupted and saying, it's not from type of hairstyles. And, I can only imagine how many times she's been essentially blamed for her hair loss by other people that required that perspective to say, hey, let's just head this off to begin with. And so that kind of dynamic is often a challenge and a hurdle. And so, when we think about that, in addition to comorbidities that you talked about, we need to put this all together. And patients need to have access to people who have that, culturally competent perspective, the time and inclination to listen to them, to make sure that we're factoring in the whole picture, and are also willing and knowledgeable about the new treatments. And often, that there can be a disparate availability of dermatologists and doctors in that position. And so, the extent to which we who, do treat this and have that are able to help facilitate that, I think that's an ongoing effort that is just so crucial for this population.
Well, and I think when you think of representation in clinical trials, our patients with skin of color who have Areata, they tend to have the more severe forms, which we know those can take even longer to respond. And those are the patients that don't necessarily respond as well. But if they're not adequately represented in our trial populations, these expectations that we're giving them about how quickly will they see their hair grow back, how long do they have to be on the medicine, how safe is this medicine for them, may not apply. And the question I always get from my skin of color patients is, has this been studied in somebody that looks like me? So I do think as a group of specialists, we need a better job making sure that our clinical trials are representative of the population that we're treating and the epidemiology of the disease that we're addressing.
Yeah, I completely agree. This is something that I believe as a field, we're making a better effort, to really accomplish that, but we also have a long way to go. And this is something that needs, intentional efforts to keep doing that, keep making progress so that we get to that point where we can say with sincerity and honesty, yes, actually it has been studied. So we have the confidence that, it's going to work for you as well.
Exactly. And Camila, I'm sure some of these challenges resonate with you when you look back on your journey till today. What advice would you give someone who's just starting their journey with alopecia areata?
I would say don't give up. It's a lot of good people trying, like the hardest, to help us. Like it's amazing having this discussion. I remember when, like, back in 2010, I was searching online, and then it was hard to find a lot of like studies, like medications. Like now, when you look it up, you can see, oh, JAK inhibitor. Oh, what is that? Like, it's something there, that is being approved. It took, like, I remember when I was looking, I saw and I said, okay, it's not approved yet. Let's see. Let's hope that it's going to be approved. And then it is. So it's hope for us, hope to keep going and moving forward, because we are on the right path, I think.
I love that. Such a great way to end our discussion. And Dr. Ungar, any final thoughts before we adjourn?
No, I just want to take the moment as we finish up to just highlight a few points that I think are just so important. We've discussed this already, so this is nothing new, but I do think they're worth emphasizing. This is a very serious condition that has a huge impact on people's lives, and there's really no way to overstate that. Whatever someone who doesn't see this is imagining the impact, you're not imagining it enough. And because of that, we, when we're in a position to help people suffering from this improve, regrow their hair, maintain their hair, I think it's just such a tremendous opportunity to make a difference. And part of that has to do with, approaching it with partnership with the patients and understanding a lot of things we discussed about, diagnosing it correctly, the ongoing treatment, the time course, setting expectations. All those things are so important. And so I hope that, the things that we've just discussed so far today really help to educate. And, it's an ongoing effort for all of us to really, hopefully get to that point where this is not new information, that this is kind of common knowledge.
And as patients, I really feel like you have to advocate for yourself, because even though your doctor may not bring up one of the JAK inhibitors like Camila mentioned, we have options out there. So it's not wrong to ask. So with that, I just want to thank both Dr. Ungar and Camila for such a rich and inspiring conversation. I know I learned a lot. And a special thank you to everyone who tuned in. I hope today's discussion gives everyone some meaningful clinical pearls that'll help strengthen your approach to alopecia areata, especially in patients with skin of color. So let's keep striving for better, more patient-centered care. Thank you all.
Thank you.
Thank you, everyone.